It's called, the clot that I had is called the Widowmaker. Very few people survive.
So I don't remember a lot of what happened except for seeing people in faces and kind of in and out of consciousness.
It felt like a cow was sitting on my chest. That's what's so scary, because there was no symptoms. I was not out of breath. I was not having cramps in my arms or legs or my neck. Didn't have headaches or nausea or nothing. I had no idea that I was having a massive heart attack.
Well, I had two arteries that were blocked 100%. And thank goodness they were able to do the stent, here, because they told me I would have probably never made it to Jacksonville or Savannah.
Patients who were having a heart attack or threatening to have a heart attack had to go 80, 100, sometimes 200 more miles away just to get that treatment. We now offer that here in our community.
It's just really hard on a family to have their loved ones out of town instead of right in your home place.
If we have to send you away on a 2-hour ambulance ride or helicopter ride, the more time it takes to you to get to a hospital where you can have your vessels open up and maybe treat a heart attack, the more time you have to damage your heart muscle. Time is muscle, and if you save muscle, you can save lives. If there's a blocked artery, say a blocked artery in the heart, we want to be able to get it open without actually doing open heart surgery. The best way to do that is to put a catheter through a patient's artery that feeds back up to the heart to get to the heart artery, open it up with a little catheter called a balloon angioplasty catheter, and then put that stent in. We at this center are able to get those clogged arteries open up in a very short period of time. As a matter of fact, we rank in the top 25th percentile in the time it takes for you to come to the hospital, get your diagnosis made, and get that blocked artery opened. It's very important to have family with you during that time of recovery. These new rooms are all private rooms, and they allow family members, 1, 2, sometimes 5 people, to be in at the same time, so that patients can heal with their loved ones at their side. Most of our physicians on staff here have board certification and extra training to allow them to be able to do a lot of complex procedures that other hospitals this size are unable to do. Our technicians are all certified, our nurses are highly trained and highly skilled, and many of them have had years of experience in taking care of heart patients and other critical care patients.
There's a lot of contentment in knowing that you have people of that caliber that are taking care of you, that are that knowledgeable.
We offer a wide variety of services, not only in cardiovascular care, but other services as well. This should be your first choice and the first thought when you have an illness. Let us take care of you. Let us diagnose your problem, let us treat it, and let us allow you to heal so that you can stay in your community and get back with your family members and get back to your livelihood.
I couldn't have got better service nowhere. And I'm sincere, I don't believe I could have went anywhere. I didn't get everybody was just as nice and courteous and polite as they could be.
It's like going home to me. And it's like family taking care of you.
Now I feel great. I can continue on with my life doing the job that I love and being there for the people.
Satilla Regional Heart Center, changing how you receive health care.